Good morning, colleagues. Today, our theme is abdominal aorta, aorta abdominalis. For this topic, we shall use Pirogov Interactive Anatomy Atlas. So, I use Scene Systems and I shall find this celiac artery, celiac trunk. Exactly, this structure is abdominalis aorta, pars abdominalis aorta, aorta abdominalis. Let's read the information. The abdominal aorta is continuation of the thoracic aorta. It begins at the level of 12th vertebra and reaches the lumbar vertebrae L4 and L5. Let's try to find this lumbar vertebra. We shall use the skeleton, and this helps us to understand the main skeletotopy points. So here it is, the 11th thoracic vertebra. Here it is, the 4th lumbar vertebra. And let's continue the information. Here, at the level of 4th or 5th lumbar vertebra, the abdominal aorta divides into two common iliac arteries. This point is called the bifurcation of aorta. So, let us do it. Arteria iliaca communis dextra and arteria iliaca communis sinistra. So, now we can see that aorta abdominalis divides into its main branches. Let's continue read information. A thin branchlet arises from the bifurcation and runs on the anterior surface of the sacrum, the median sacral artery. Let's find it. Arteria sacralis mediana. Here it is. Arteria sacralis mediana. Quite long branch. Really, we can see that it runs on the anterior surface of sacrum. Really. Arteria sacralis mediana. Okay. Let's continue read information about abdominal aorta. Two types of branches can arise from the abdominal part of aorta: the parietal and the visceral. The parietal branches are phrenic arteries and lumbar arteries. Phrenic and lumbar. Let's find them. arteria phrenica inferior. Here they are. Now I want to paint them. It's better seen in such situation. And let us find diaphragm. Here it is, the diaphragm, and now we can really see that this red color artery is right arteria phrenica inferior. And here it is the left arteria phrenica inferior. So they belongs to the parietal branches. You remember that abdomen has several walls. Superior wall, which is diaphragm, inferior wall, which is diaphragm of the pelvis, and anterior, lateral, and posterior walls. So inferior diaphragm arteries, they are parietal branches. And then we have read that there are also lumbar arteries. Here they are, and again let's paint them. So, do you remember how many lumbar vertebrae exist? Surely 5. And how many intervertebral spaces? Surely 4 intervertebral lumbar spaces. So how many lumbar artery exist? Again 4. In each intervertebral lumbar space we can find its own artery. So 1, 2, 3, 4 from left side, 1, 2, 3, 4 from right side. Now we can say that we have shown all parietal branches. And now let us continue information about abdominal aorta. The visceral branches are unpaired celiac trunk, inferior and superior mesenteric arteries, and paired suprarenal arteries, renal arteries, testicular arteries, or avarians arteries. So, unpaired, there are 3 of them: celiac trunk, inferior mesenteric artery, and superior mesenteric artery. Let's find the structures. So I again use scenes. Again, use this example, this scene, and I already have colorized the celiac trunk. Here it is, of red color. It's celiac trunk. Let's read the information about celiac trunk. The celiac trunk is a short vessel, 1 or 2 centimeters long. When I turn our model from lateral side, we can see that really it's quite short, 1 or 2 centimeters. Departs from anterior surface of aorta at the level of the upper edge of the body of first lumbar vertebra, or the lower edge of the body of the 12th thoracic vertebra, at the place where the abdominal aorta exits the aortic hiatus. So let's find these structures. First of all, again, we shall use the skeleton, and let's try to count. This is 12th thoracic vertebra. So truncus celiacus really in this model is lying on the level of 12th thoracic vertebra. And again, we shall use the diaphragm. So, here it is. It's good seen that celiac trunk appears in hiatus aorticus diaphragm. So it is most superiorly located unpaired branch of aorta abdominalis. Let's continue read information about celiac trunk. This artery is directed anteriorly and immediately divided into 3 branches. The left gastric artery, arteria gastrica sinistra, the common hepatic artery, arteria hepatica communis, and the splenic artery, arteria splenica or arteria lienalis. Let's find them. So truncus celiacus divides into 3 branches. This is left gastric artery, arteria gastrica sinistra. Let us find the stomach, the gaster. Here it is. So we can find that arteria gastrica sinistra runs on curvatura ventriculi minor. Here it is. Left gastric artery, which is on curvatura ventriculi minor. In this place is located the less epipleon. So practically in this structure is hidden arteria gastrica sinistra. Then second branch of celiac trunk, let's hide the stomach. Second branch is this common hepatic artery, Arteria hepatica communis. Let us colorize it with red color. So, Arteria hepatica communis. We can see that it is directed anteriorly, and then it gives several branches. One of it, we can say the daughter's branch, is right gastric artery, Arteria gastrica dextra. Let us again colorize it with the red color, and now we can see that it makes anastomosis with left gastric artery. So together they make arterial ring in curvatura ventriculi minor. Now I want to return the stomach invisible manner, invisible way, and I colorize this arterial ring, so we can see Arteria gastrica sinistra and Arteria gastrica dextra, which meets each other on curvatura ventriculi minor. And let's return to the Arteria hepatica communis, because before, let's again hide the stomach, before it also gives one another artery, Arteria gastroduodenalis. Again, I want to paint this structure. Arteria gastroduodenalis runs downwards, and again a new branch, Arteria gastroepiploic dextra, appears from it. So let us colorize it. Arteria gastroepiploica dextra, which is branch of Arteria gastroduodenalis. And we can see that Arteria gastroepiploica dextra runs on curvatura ventriculi major ventriculi. So let us hide the diaphragm, the stomach make visible. So curvatura ventriculi major is this convex part of stomach, and here we can find two arteries. One of it, this one, Arteria gastroamentalis or gastroepiploics, its synonyms, gastroamentalis or gastroepiploic dextra and Arteria gastroepiploica or gastroamentalis sinistra. To find this branch, we need colorize it. Here it is. Arteria gastramentalis sinistra, or left gastroepiploic artery. It is branch of splenic artery, of third branch of celiac trunk. So here it is, the celiac trunk. Again, it has three main branches. Left ventricular branch, common hepatic branch, and splenic branch, or splenic artery. Here it is, splenic artery. I also paint it. And now we can see that the daughter's branch of splenic artery, from left side, it calls as arteria gastro-ommentalis sinistra, and it make anastomosis with arteria gastro-ommentalis dextra. So here there is a ring, arterial ring, on curvatura ventriculi major, and also we have ring on curvatura ventriculi minor. Again, let us make stomach visible, and it's good possibility to see the anastomosis between two artery on the curvatura ventriculi major and two arteries on curvatura ventriculi minor. And maybe last point, let's add the spleen. For best understanding the situation in whole. Oh, like now. So stomach, lesion, and main branches of celiac trunk. Thank you.